It's great to be back here to San Antonio for San Antonio Breast Cancer Symposium 2021, and it's a pleasure to have this opportunity to discuss with you the two posters that I co-authored and we presented yesterday here at San Antonio Breast Cancer Symposium to this year edition. So the first poster we presented was a sub-analysis of post-hoc sub-analysis of the ALTTO trial, which is, as you might know, a big adjuvant trial for anti-HER2 treatment for HER2 positive early breast cancer patients that recruited more than 8,300 patients with HER2 positive early breast cancer and randomized these patients to 4 different arms of anti-HER2 treatment, so trastuzumab, lapatinib, trastuzumab followed by lapatinib, or trastuzumab with lapatinib concomitantly. And this trial, as you also might remember, had 3 different designs. So the design 1, where patients were randomized after receiving surgery and complete adjuvant chemotherapy to the randomized to different anti-HER2 treatments. A second design, which was a design that randomized patients after receiving surgery and anthracyclines and received taxane concomitantly with anti-HER2 treatment, and the third design, the 2B design, which was a design where patients were randomized immediately after surgery and received docetaxel and carboplatin together with anti-HER2 treatment. So basically, in this sub-analysis, what we intended to study was the potential impact of erythropoietin administration in clinical outcomes of the patients included in this study. This is based on the background knowledge that we know from preclinical studies that show that activation of erythropoietin receptor could be associated with tumor proliferation and the potential impact on anti-HER2 treatments resistance, and therefore we aim to analyze the usage of the administration of erythropoietin in the clinical outcomes of these patients, such as PFS and overall survival. And of course, we analyze this by Kaplan-Meier, comparing the EPO cohort and non-EPO cohorts, meaning the EPO cohort, the patients, including patients that received at least 1 administration of erythropoietin, and the non-EPO cohort that did not receive EPO at all during the study participation. And we also performed a regression analysis, a Cox analysis, controlling for all the potential confounders, as we know, that could have different distribution between the arms, as this is a retrospective analysis by its nature. And we also reported the potential adverse events related with EPO administration, such as cardiovascular events and thromboembolic events, as you know, are the most commonly related with EPO. Basically, in terms of baseline characteristics, there were no statistically significant difference between the 2 groups, the EPO and non-EPO cohort, except to the timing of chemotherapy, which is obviously explained by the 3 designs I previously mentioned of the study. So as expected, patients receiving erythropoietin were mostly included in the design 2 and 2B, where chemotherapy was given concomitantly with anti-HER2 treatments. And as main results, we found that this EPO cohort consisted on 123 patients, about 1.5% of the whole study population, which is a small proportion of patients, and there was no statistically significant difference both in PFS and OS when we compared the EPO cohort and the non-EPO cohort. And when we did a sub-analysis, a subgroup analysis of all the potential confounders of the baseline characteristics, we found that within the subgroup of premenopausal women, which is a rather small subgroup of 48 patients receiving EPO, there was a statistically significant benefit favoring the administration of EPO for the EPO cohort. This has to be considered with some caution, caution, as this is a rather small subgroup of patients, of 38 patients, and this statistically significant difference is based only on 3 events. So another additional event of her DFS could change the statistical significance of this finding, which was not reproduced for the overall survival analysis. This was also found on the Cox analysis when we tested for the interaction between the menopausal status and the EPO administration, showing a statistical significance for the interaction for premenopausal women receiving EPO administration. So basically, these findings are reassuring for the use of EPO administration with no clinical impact on the patient outcomes, and as well with no safety signals when we did the adverse events analysis that did not show any specific difference between the cohort of EPO administration with the non-EPO administration cohorts, basically meaning that it's relatively safe to administer this drug in this setting.